Anyway, we'll talk about that a little more. What I want to do, because this American Health Care Act is really the biggest thing that's been rolled out in the last 24 hours, I kind of want to tear it apart for you today because a lot of people are going to be talking about this. It's complicated. There are certainly big differences between this and Obamacare, but there's several things that it has in common. And I just think it's important that we understand what's in it and what's not in it. And to do that, I've asked Rachel Bovard to join us here from the Heritage Foundation. And Rachel is the Director of Policy Services for Heritage. Rachel, how are you?
I'm well. Thanks for having me.
Well, thank you for coming on and giving us some analysis of this health care bill. Rand Paul has called it Obamacare Light. You wrote on this issue pretty extensively earlier this week about what you thought the bill needed to have and what it didn't need to have. What do you think of what they've rolled out?
Well, the first thing that I think is why haven't they passed the 2015 full repeal bill? That passed both chambers in 2015 and got at the guts of Obamacare. That bill is not reflected in what we've seen from the House GOP today. Some of it's there, but certainly some other provisions have been added or not included. And, I think Rand Paul is right to question it because a lot of these members ran and won on the idea of full repeal of Obamacare. And I think, a lot of these members feel that that's not what this draft represents.
Yeah, it certainly, it repeals a portion of it. In fact, the first section says repeal of the Patient Protection Affordable Care Act. But there are portions of it that are very similar, too. Can you kind of compare and contrast that for us?
Yeah, a couple of the biggest sections that, don't get at the heart of Obamacare. The draft that the House GOP released today does repeal the Obamacare taxes, but it allows one of the biggest taxes, the Cadillac tax, to come back in 2025. So that's problem number one. And then problem number two for a lot of conservatives is the fact that this bill does not get rid of the Medicaid expansion. And this is that huge expansion of the welfare state under Obamacare. It paid states, 90% of the coverage to expand Medicaid in their states. And this bill doesn't get rid of that. It simply locks it in. And that's a huge part of Obamacare that's not being addressed.
Yeah, just to remind people, because I've talked about this at some length on my show, but the Cadillac tax is not a tax on the kind of car that you drive. It is a tax on some people, probably largely union members, have pretty good health care. In some cases, really low premiums, really low deductibles. What the Cadillac tax would do would be to basically penalize those people who have these Cadillac plans and force them to be taxed on part of the value of that healthcare plan because they're not currently taxed on any of it. It's sort of a loophole in the law. None of us are really taxed on our healthcare benefits, but this would particularly target those really good healthcare plans. Is that right, Rachel?
That's right, and that's a problem for some conservatives. Another big problem for conservatives, and particularly Rand Paul has been very vocal about this issue, is the tax credits, the refundable tax credits that are in the bill. There's some conservatives that think tax credits are another form of a subsidy. They'd rather see a standard deduction there. And that's, the GOP has dealt with this issue by means testing it. So, for people at certain income levels, they'll get the refundable tax credit, and people, above, like individuals making $250,000 or more will not be allowed to have those tax credits. So the three big issues that have to be dealt with are, again, these taxes, the refundable tax credit, and then also the Medicaid expansion. And it's unclear if the bill, even if it passes the House, it's unclear if it can get through the Senate without addressing those issues.
Are there HSAs included in this health spending accounts?
HSAs are dealt with in the bill in a positive way. And like I said, there's some elements of this bill that reflect the full repeal in 2015 that are good. Getting rid of most of the Obamacare taxes, we'd like to see all of them repealed. Expanding HSAs, banning Planned Parenthood funding for a year, and things like that. Those are all good things that can be done. But the issue is, we already have a bill that passed in 2015, passed both chambers, pass that, and then use the 2-year phase-out in that bill to debate a replace plan that really allows the free market to work and allows affordable and accessible coverage for everyone.
Yeah, it makes me concerned that they're rushing this through for for political reasons. But you're right. If they had one that was plug and play, I wish they would have just used it. I guess my other question is, if this bill eliminates most of the Obamacare taxes, with the exception of that Cadillac tax, which it pushes off for a couple of more years, how do they pay for the expanded tax credits? I mean, I know CBO hasn't judged this thing yet; they haven't really scored it, but it strikes me that there may be a cost associated with this.
I think there will be a cost associated with it. Again, CBO hasn't come out with any firm numbers, but I suspect that that's why you see that Cadillac tax coming back, Kate, at the state level, is by reinstituting a tax in the out years, and that's a big problem. And the Republicans are going to have to find some way to justify it.
Well, I've got a comment here from Roy Blunt, who doesn't think this version of it's going to get a lot of support in the Senate. What I heard today was, here's the bill. Everybody's going to get to read it. It's going to go into reconciliation between the House and the Senate, and then amendments can be made to it. Can enough be done to it in reconciliation to make this thing workable?
Well, the danger of reconciliation, and again, this is the budget procedure that allows a bill to pass in the Senate with 51 votes instead of the usual 60 votes, and that's why it's such a powerful tool. But the thing with reconciliation is that it's not just amendments that can be addressed in the process. It's what we call points of order. And it's not clear that what the House has drafted will survive in reconciliation. And what I mean by that is there are certain provisions that might not be allowed. And so, again, that's why the 2015 bill is so important, because it proved that it could pass the House and the Senate, including those complex procedures in the Senate. And so that's why conservatives have been saying for months now, pass the 2015 bill, it can get through the Senate. This bill that the House has released today is untested. It could come up against several big objections in the Senate, not just ideological, but procedural as well.
Well, that's a good point. I'm going to have a couple of our local Congress people on the air the next couple of days. I'm going to be sure and ask that question, why the other one wasn't considered. Rachel Bovard with the Heritage Foundation. I'll direct people to heritage.org. Thank you so much for your time.
Thanks for having me.
All right, you bet. Hopefully that gives you a little more insight into some of the difficulties we're facing here.